I have always been interested in a career working with people, helping them in some way. I especially have always wanted to work with kids. A pediatrician is a medical doctor who manages the physical, behavioral, and mental health of children from birth until age 21. A pediatrician is trained to diagnose and treat a broad range of childhood illnesses from minor health problems to serious diseases. I conducted an interview with Dr. Harvey of Essentia Health. He has been a pediatrician for almost 22 years. I asked him to describe a day for him, and he said, "I get to the hospital around 7:30. I round on the babies in the nursery and give them their first exams. Then I go check on my patients that are sick and in the hospital. Then I prep my charts and see my first patient at 8:40. I see patients until about 4:30, so there isn't much downtime. I usually leave the office at about 5:30, and then I go home, which at home I do a couple more hours of charting." To become a pediatrician, you must graduate high school, a 4-year college, medical school, and then complete an internship and, in most cases, a 3 to 5 year residency. You won't actually be working at the job until you're roughly 30 years old. Some advantages of this job is getting to solve problems so children can be safe and healthy. You can work in most cases in any city or state that you want to. You get to meet a great variety of people and make great connections with them. Some disadvantages of being a pediatrician are always working inside, having very small breaks, constantly working with people who have diseases, illness, and infection. But those are all things most people are aware of going into the career. Some people aren't aware of the extra hours spent outside of work charting. When I asked Dr. Harvey about what a drawback for this career is, he said, "Parents, without even trying, can do things that negatively affect their child, and that can be very hard to watch, which is why it's a very important part of the job to be a very good advocate for the child. It can sometimes involve a lot of tough decisions, but in the end, I have to make sure I'm doing what is best for the patient or child." In the future, there is going to be a greater need for primary medical care because of an increasing population. So, there will be a bigger need for more pediatricians. It's a great career to go into because there's always going to be a need for them. And the need is growing faster than most other medical careers. When I asked Dr. Harvey what originally interested him in this career, he responded right away with, "I always kind of knew what I wanted to do. I was good at science and I knew I wanted to help people," which is the most cliche but pure reason to go into medicine. I love children and I can be a really strong advocate for them. So if you want to help people, specifically children, a pediatrician would be a great career for you.